How to recognize signs and symptoms of Ebola. Ebola is a deadly disease that is caused by the Ebola virus. The 2014 outbreak of Ebola in several countries in Africa has made it very important that you know what the symptoms of this disease are. You can contract Ebola if you come into direct contact with the bodily fluids of a person who is already showing symptoms of this disease. Keep in mind that Ebola is not spread through water, food, mosquitoes, or air. If you have the symptoms listed below, and have visited or are in an area where infections have been reported, it is important that you seek a medical diagnosis right away. To learn more about preventing Ebola, click here. Method 1: Recognizing early symptoms. 1. Check to see if you have a fever of 386 degrees Celsius (101.4 degrees Fahrenheit) or higher. When you become exposed to a virus, your body reacts by increasing your internal body temperatures, thus creating a fever. Fevers are meant to burn out the infection, thereby protecting you from the virus. The Ebola virus also stimulates the production of cytokine and histamine in your body. The increased production of these two chemicals can also lead to a fever. 2. Monitor any headaches you experience. Viral infections often cause headaches, which means headaches can also be a sign of other illnesses, not just Ebola. Headaches occur when blood vessels in your head become narrow due to fever or infection. 3. Keep track of any sore throat you develop. This symptom may not be present in some Ebola patients. When the virus begins to spread through the body, it creates symptoms much like the flu, so there is the potential for a sore throat to develop. Your throat may begin to feel scratchy or dry. This can lead to irritation of the throat lining, which leads to a sore throat. 4. Watch out for stomach pain. This happens when virions, virus particles, start invading the gastrointestinal tract. The virions will attack the intestinal cells, thus causing stomach pain by altering normal gastrointestinal activity. Method 2: Recognizing later symptoms. 1. Look for internal and external bleeding. This virus is also known as Ebola hemorrhagic fever. This is because the virus causes roughly half of Ebola patients to lose blood from puncture sites, or from mucosal membranes, such as the lips and gums. This bleeding occurs because the virus causes damage to the blood vessels. This bleeding can also occur around the ears, eyes, nose, and anus. It may also cause blood to appear in stool. 2. Monitor vomiting or nausea you experience. If you have contracted Ebola, you will begin to vomit frequently. The virus creates chemical abnormalities that the body considers poison, which leads to vomiting. 3. Take note if you experience diarrhea. Since intestinal and gastric cells are being damaged by the virions of Ebola, you may begin to experience frequent diarrhea. Diarrhea is defined as loose, watery stool that occurs at least 3 times a day. 4. Keep track of a loss of appetite. As the virus multiplies in the body, it can weaken systems, including the digestive system. The virus may begin attacking endothelial cells, which are located in the stomach. When this occurs, you may lose your appetite. 5. Look for skin rashes. This rash generally appears roughly 5 days after you have been infected with the virus. The rash is caused by increased levels of histamine in your body. This rash is often prominent on the chest, though it can also cover the rest of your body. The rash will look like numerous red dots that may be raised, though sometimes they are not raised. 6. Check for signs of impaired liver function. Virus particles in the gastrointestinal tract will also damage and attack hepatocytes, which are cells found in the liver. If this occurs, the liver will leak bilirubin, a yellowing substance produced in the liver, into the blood vessels. When excessive bilirubin is in the blood, it may cause jaundice to occur. Jaundice causes the skin and whites of the eyes to take on a yellowish color. Method 3: Seeking a medical diagnosis. 1. Take into consideration places where you have traveled recently. Even though Ebola has only manifested in Africa, this 2014 outbreak has cases of imported Ebola, which means that people who were infected with Ebola returned to their native country and developed symptoms upon arrival. For this reason, anyone who traveled to parts of the world where Ebola is present should immediately report to local healthcare centers, especially if symptoms like the ones mentioned above appear. 2. Contact your doctor. An imported case of Ebola is the only way for you to get ill if you have never visited or lived in places where Ebola is known to be present. For this reason, it is impossible for people to contract Ebola anywhere else, even though individuals might experience the exact symptoms. It is most likely that in these cases, some other disease is affecting them. Nevertheless, it is best to report to your physician once these symptoms appear, to establish a diagnosis promptly. 3. Get an enzyme-linked immunosorbent assay, ELISA, test done. This test measures and detects antibodies in the blood. This is used to determine if you have certain antibodies that are related to certain infections. In performing this test, a blood sample is taken from your arm. The blood serum is sent to the lab for testing and analysis. The result will indicate if you are positive of an Ebola antigen in the blood. 4. Be prepared to get a reverse transcriptase polymerase chain reaction, PCR, test done. This diagnostic test can diagnose Ebola virus faster than an ELISA test. PCR can also detect the viral load inside the body and is able to measure amplification of DNA. This procedure will test your blood, plasma, and whole blood. If positive, the result will show that an Ebola antigen is present on the serum. You can generally get results within 48 hours. Method for understanding how Ebola is spread. 1. Be aware that contact with an infected animal could lead to contracting the virus. Ebola is normally found among bats and wild monkeys, making these animals a reservoir for the virus. Direct contact with these animals, or their secretions, can result in contracting the disease. 2. Minimize any contact you have with other people's bodily fluids, as this is how the virus is spread. Once a human gets infected with the disease, human-to-human transmission is possible through direct contact, including touching, sexual transmission, and by being exposed to infected bodily fluids. This means that in order for the virus to be transmitted from one human to another, physical contact must be made, whether it includes bodily fluids or just skin contact. The virus can stay alive in sperm tissue for roughly 60 days, making male individuals highly infectious for a prolonged period of time. 3. Understand that Ebola cannot be transmitted through the air. Some other viruses, like influenza, can be transmitted through air, making them highly infectious, but Ebola is not transmitted this way. Warnings. The major risk factor for Ebola transmission among humans is poor hygiene and unawareness of its danger. As mentioned previously, it is known that in order for this virus to be transmitted,